Good morning to you all. I'm Renee Francoeur with Cabinet Communications and the moderator for today's COVID-19 update. We are joined today by Premier Sandy Silver and the Acting Chief Medical Officer of Health, Dr. André Corriveau. Closed captioning is provided by National Closed Captioning. Thank you to Mary Teason for providing our ASL interpretation and to André Boussier for providing our French translation. Following the remarks from our speakers, we will go to the media present in the room and then on the phone lines for a round of questions. I will call you by name and you will each have 2 questions. Before we begin with our speakers, I would like to verify that everyone can hear us. If any of the reporters are having problems, please email ecoinfo@yukon.ca. I will now hand it over to Premier Sandy Silver.
Thanks very much, Renee. And thank you, everybody, for joining us. We're here on the traditional territory of the Kwanlin Dun First Nation and the Da'an Quachin Council. There's a new face in the room, obviously, as introduced. So very pleased to introduce you to our locum Acting Chief Medical Officer of Health, Dr. André Corriveau. Dr. Corriveau will be maybe a new face to Yukoners, but he's certainly very well known and respected right across the north. He served as the Chief Public Health Officer for Northwest Territories for over 15 years and was also the Chief Medical Officer of Health for Alberta for several years as well. So we're very excited to have André with us. So thank you very much for joining us. And I speak for all Yukoners when I say that we're happy to have you here in the Yukon to inform our public health response to COVID-19. Thank you, sir. Dr. Corriveau will provide an update on the current status around COVID-19 across the country in a moment. Tragically, last week we lost another Yukoner to COVID-19, the 11th death since the pandemic began. Our sincere condolences go out to the family members and the friends of this individual. This is very sad news, and all of Yukon is grieving with you. COVID-19 is obviously still a very real threat. It can be very deadly, especially for the unvaccinated. This is a tragic and stark reminder of how important it is to get your shots, to protect those around you who may be at more risk, and to protect those like our children who cannot yet receive the vaccinations. We're currently in a state of emergency as we work quickly to respond to the spike in cases that we've seen and to take steps to reduce the transmission. There is widespread community transmission occurring right now, and we are still seeing high daily cases, around 30 per day. I know that there's been a lot of concern in and around schools. Dr. Corriveau will speak to this in a moment, but it's important to note that in most cases, children are becoming infected from known exposures at home or in the community and not from attendance in school. Our schools remain safe places for students, and I want to thank all of our educators and our staff throughout the territory who have supported our students throughout the pandemic. The staff at schools have learned how to adapt to continue to provide remote learning when disruptions occur, and they continue to work extremely hard to support our students. So from custodial, administrative, supports, parents, teachers, all of the community that are involved with our kids, thank you very, very much for keeping our students safe. We recognize that Yukoners have very many questions about accessing COVID-19 testing at the COVID Testing and Assessment Center. Now, as part of our comprehensive testing strategy, the lab-based Gen Expert testing device has been used in cases where frontline staff, such as physicians, nurses, teachers, that have symptoms of COVID-19, and a quicker result is required, so to ensure health and safety of of their patients or school communities. This is our practice. So this is not a new practice, but this is what we've been doing consistently. It has been part of an ongoing testing strategy to ensure the health and safety of our schools when an urgent result is required. So teachers, school administrative staff who are symptomatic seek testing at the COVID Testing and Assessment Center, and declare their profession will have their test results processed using the Gen Expert device, so they do not need to await results from British Columbia. Now, this practice is not available to asymptomatic individuals. It's an extremely important distinction. This device has a limited capacity and cannot be used in every scenario. And our top priority is to ensure that our overall testing capacity is not overwhelmed and remains available to address public health needs. With the increase in cases, we must be all very careful and considerate of our fellow Yukoners. On Saturday, November the 13th, new ministerial orders under the Civil Emergency Measures Act came into effect. Now, these measures have been recommended by the Acting Chief Medical Officer of Health to rapidly reduce transmission and to ensure that our healthcare system is not overwhelmed. So these include mandatory masking, limits on personal gatherings, organized gatherings, seated ticketed events, and faith-based and cultural gatherings, and restrictions on restaurants, bars, nightclubs, gyms, fitness studios, and personal services. Now, as you know, a more detailed list of measures is available online at yukon.ca. You can also find a list of places where proof of vaccination is required, along with an extensive set of questions and answers about the new measures. I encourage all Yukoners to review this information and to go to yukon.ca for the most up-to-date and accurate information. I do absolutely want to thank the many public servants who have been working diligently over the last several weeks to make this information available. We continue to actively respond to an extremely dynamic situation when it comes to this pandemic. And we've learned time and time again that things do change, and things do change very, very quickly. Over the past 20 months, the public service has learned to pivot quickly and to stay nimble as we respond to COVID-19. It has not been an easy job, and I want to thank everybody for their hard work and their dedication. These folks are tired, but yet their professionalism is still there, and I'm very, very appreciative of our public employees. Now, these new measures, they're absolutely necessary to protect the health and safety of Yukoners. They are in line with many other jurisdictions. In the news, you would have heard of numerous European countries imposing new restrictions this week, as well as they experience, the resurgence in their jurisdictions and their countries of COVID-19. But I also want to remind Yukoners that these are temporary measures. We are not in a lockdown. These measures, including limits on gathering sizes, are to disrupt the rampant transmission that we are seeking. We heard in the news just yesterday as well of a new strand of Delta in BC, first case there. So again, these measures are important, and they're there based upon science, and they're what we need to do to keep folks safe. Now, if we're successful, this will be a circuit breaker that will dramatically decrease the spread of COVID-19 so that our healthcare system does not become overwhelmed. These measures are in place until at least December the 3rd. If we all take precaution, our hope is that we will not have to extend beyond that. But we have to play a role in preventing further spread. So please follow the Safe Six. Encourage your friends and family members to do the same. As of this past Saturday, proof of vaccination is now required to access designated settings. This means you need to be fully vaccinated, so you should have proof of your 2 shots to enter places like gyms or an art gallery or a pub. You can find a list of these settings on yukon.ca as well. Now, the list of designated settings is based on the BC model with Yukon-specific considerations based upon the recommendations of the Office of the Chief Medical Officer of Health. You can show your paper or digital copy of your proof of vaccination credential as well as a piece of government-issued photo ID in order to access these establishments and services on the list of designated sites. You can also show the blue immunization record that you were given when you first received your vaccinations. However, you can only use this blue card up until November the 30th. As of December 1st, you'll need to show your government-issued proof of vaccine credential. Yukoners can access their proof of vaccine credential online at yukon.ca/vaccine-proof. Or you can call 1-877-374-0425. This line is open 7 days a week from 7:30 in the morning till 8 o'clock at night. As I have mentioned for a few weeks now, a Yukon-specific QR code reader app is being developed to support local businesses and organizations to verify vaccination status. We want to make this process easier and faster for establishments and service providers. Our IT folks, they have submitted the app to Apple and to Google, so it can be made available widely through their app stores. The app will securely verify an individual's proof of vaccine credential. It can be available, it will be available to read any QR code that follows the Government of Canada's specifications for proof of vaccination credentials. The app does not need an internet connection to verify the QR codes. It will be freely available on both the Google Play Store and the Apple App Store for download as soon as those organizations approve the app. As we all adjust to these new measures, I want to remind Yukoners and ask them to be patient and respectful of businesses and organizations as they implement these important public health requirements. We know that there have been comments on social media about unacceptable behavior in response to businesses that ask for proof of vaccination and enforce the mask mandate. Again, please, Yukoners, be kind and be respectful. These businesses and organizations, they're doing their part. They're doing their part to help protect your health and your safety. And we all do have a role to play in this, and we are all in this together. We need to support each other to get through this, or else it will last even longer than anybody really wants it to. More than just being respectful, I'm urging Yukoners to support these local businesses. Now, these temporary measures are challenging for everyone, especially for businesses, and we need to continue to show them their support. Many have sorted out how to do curbside pickup, or quickly adapting to continuing to provide quality services that we know and expect from Yukon businesses. So please, I'm urging you to all show your support. Our local businesses are part of what makes our territory so great, and supporting them is extremely important for our economy. As folks start looking towards the holiday season and gifts, look no further than Yukon businesses for providing those. I want to see a lot less Amazon packages and a lot more local businesses under the tree. With all the restrictions, we completely understand how stressed folks are, and we know that these new measures, they're not making anybody's lives easier. We're extremely thankful for everyone who is digging deep and doing their part. Every time that you choose to follow public health recommendations, you're making a huge difference. By wearing a mask, by limiting your social interactions, getting vaccinated, washing your hands, you help to limit the spread of COVID-19. You help to reduce tragedy. This we know. We've dealt with this before, and we can get through it. The case numbers, they speak for themselves, folks. We need to take immediate action to stamp out the spread of COVID-19, and that's what we're doing. Our priority remains to protect the health and safety and the well-being of Yukoners, while also maintaining our capacity in the healthcare systems. Now, before I pass it off to the good doctor, I just want to repeat that we need everybody to follow the Safe 6+1. Stay home if you're sick. Arrange for testing, no matter where you live. If you're outside of Whitehorse, contact the local health care center. If you have medical questions, you can call 811 to speak to healthcare professionals. The drive-through testing facility is open again to meet the increasing demand for testing. It's open from 8:30 in the morning till 5:30 at night, 7 days a week. And it is located on the Alaska Highway at Centennial Motors in the Wash Bay. No appointment is necessary for testing here. Just cruise on in. Let's mask up. Let's book our vaccine appointments. Maintain physical distance. Respect our local business folks, and also our extremely hardworking healthcare professionals. Yukon has a strong track record of coming together in times of need, of being good people, and we're in these times where we really need folks to be kind to each other. So I want to thank you for listening today, and I'll pass it off to Dr. André.
Well, thank you, Premier Silver, and for your warm introduction and welcome. Bonjour tout le monde. I want to start with a case count overview. There's been a total of 1,322 cases to date, with 1,139 people who have recovered and 11 Yukoners who have died from COVID since the beginning of the pandemic. And as of this morning, we have 157 active cases in the territory. We currently have 6 COVID cases in hospital. And in the past week, we've continued to see high daily case counts, but we expected this. The epicurve appears to indicate a plateauing at this point in the average number of new cases, which, as Premier Silver mentioned earlier, is hovering around 30 per day. I think it was 32 yesterday, but it does fluctuate from day to day. And the percent of cases who are fully vaccinated since June to present is about 29%, but most of those breakthrough infections are still noted to be quite mild and shorter duration of infection. So it's certainly a big difference from, so the risk of more serious illness remains in the unvaccinated population, or people who for issues related to their immune status may not respond to vaccines well anyway. Our test positivity, as in the past week, has been on average around 15%. So that indicates it's fairly high. So it indicates there's probably a lot of undetected infections. So people who choose to not to go and get tested, but as long as they remain home and isolate themselves, there's probably something that we have to understand may be happening as well. Most of the community spread remains within Whitehorse, with small clusters in a number of other communities. So currently, active case-by-case data that I have really identifies where people, community of residence. So it doesn't mean that that's where they were diagnosed or where they're currently living, but where their health care card indicates their permanent residence is. So we have 2 cases, a residents of Carcross, 9 cases, residents of Carmax, 2 cases, residents of Dawson, 1 case, resident of Faro, 2 cases are residents of Mayo, 5 cases, residents of Pelly Crossing, 3 cases, residents of Teslin, 9 cases are residents of Watson Lake, and then 119 cases are residents of Whitehorse, with 5 cases that were not Yukon residents. I just want to mention briefly also that there was a big hockey tournament in Teslin last weekend, so we do expect that because there's been a few cases identified related to that event that we expect that there might be a further cluster that is linked to that. So we certainly ask people who participated in that event and spend time there that to at least self-monitor, and particularly if they were not vaccinated, to go and get tested quickly if they develop symptoms. I know there's been a lot of questions around the age breakdown of cases, so I'd like to speak to that briefly. Over the past 2 weeks, about 30% of our cases are in the under 12 population, so it is significant. But I think the good news that I'd like to highlight is the fact that only 4% of our cases are in the high school population who have been immunized since the summer, so it's showing a very good response to the vaccine in that age group, and we're not seeing any significant number of cases in that population group between 12 and 17 years old. And then we have 2/3 of our cases are still in the 18-plus population. So that's where the bulk of the community spread is still happening. We continue to see, as Premier Silver also highlighted, the fact that although we have cases in the under 12, most cases when we do the investigation do not appear to have been acquired in the school setting, but more, what happened, in the home or community context, at birthday parties, sleepovers. We had Halloween parties recently, so that's where much of the spread has been occurring. So we commend the school system that are still applying the lessons learned from the past almost 2 years now, but because of the current context, there was a mandate that was added for children 5 years and older to temporarily wear a mask at all times while in the school, just to increase again the degree of protection within the school system. But unless there's a clear outbreak identified that would be linked to the school, we're still not recommending to close schools just because of a case of COVID. So I'd like to take also a few minutes to explain what the circuit breaker concept that Premier Silver mentioned. The intent of the circuit breaker is to establish a brief but strict set of measures in order to stop cases from rising to a rate where it would overwhelm the healthcare system. The intention is to keep these enhanced measures in place for the shortest possible time and only as required. The current restrictions were developed and implemented quickly in response to a sharp and seemingly exponential increase in the first week of November in the number of cases seen. As I highlighted in the last week, we're seeing a plateauing of that curve. It's still high, but we think we're headed in the right direction. The goals are to break the chain of transmission by limiting group sizes and protect our healthcare system in the process. As we know, across the north, our healthcare systems are very fragile, depend on fewer people, and must rely on support from the south. So we want to make sure that it can easily become overwhelmed. So that's an important consideration in the assessment that Dr. Elliott made when those recommendations were made. It's too early to tell at this point how effective things are working. Usually, in my experience in other jurisdictions, it takes 2 or 3 weeks before the full impact can be fully assessed. So we're keeping a close eye on our indicators. We're seeking to make further progress on completed immunization rates, which still remains our best long-term strategy. So to implement the booster doses for those who are at higher risk, and continue to encourage those who are still not received their first and second dose, and those are the people we will prioritize in our vaccination program. Over the last week, we've had a number of questions regarding the public health measures that were recommended by the acting chief medical officer. Personal gatherings are limited right now to 10 people from a maximum of 2 households if eligible people are vaccinated, and 2 household members only if there are unvaccinated people among the group. This limitation applies to all public and private places. Eligible people refers to anyone 12 and over. So if you're a family visiting with another family and you both have kids under 12, you can gather up to 10 people so long as all the adults are fully vaccinated. Indoor organized events such as weddings, funerals, receptions, parties, conferences, trade fairs, and workshops are limited to 50% occupancy for that space, or 25 people, whichever is less. And proof of vaccine and masks are also required for these events. Outdoor organized events such as weddings, funerals, receptions, parties, conferences are limited to 50 people with proof of vaccine and mandatory masking. Indoor and outdoor faith-based and cultural gatherings are limited to 50% occupancy with 25 people indoor or 50 people outdoor. Proof of vaccine and mandatory masking are also required. The same thing as sports for people 12 years of age and older. Organized sports can continue with the following requirement. Indoor sports are limited to 50% capacity for that space, or 25 people, whichever is less. Outdoor sports are limited to 50 people, and proof of vaccine and masks are required for both indoor and outdoor. But if you're engaged in a high-intensity sports, such as hockey or soccer, you can remove your mask during play, but put it on as soon as you're off the ice or the court. As always, it's important to stay home if you're feeling ill, even if slightly. And if you would like to speak to a medical practitioner, please call 811 to speak with a nurse. If you need to book a COVID-19 test, please contact the COVID-19 Testing and Assessment Center to book the test, or if you can access the drive-through testing facility that opened last week. And if you live outside Whitehorse, please contact your healthcare center to book the COVID-19 tests. I'm very pleased to see that vaccination rates are continuing to rise, especially for people who are getting their first and second dose. As I mentioned earlier, I think this is still the way out, and it's going to make a huge difference in terms of our ability to navigate moving to an endemic approach to COVID-19. And each person who gets their shot is a person who is more protected personally, but also less likely, even if infected, if they are in a context of exposure, to get infected and to spread the virus to people who are more vulnerable around them. About 3,100 people have gotten their booster shot so far in the Yukon. It's an impressive number, given that we only started delivering boosters to people 50 years of age or older on November the 1st. I understand that some people are frustrated with the lack of appointment availability on the website. Boosters are added regularly and they book up very quickly. However, there will be appointments available for everyone who wants to get their booster. We appreciate everybody's patience. Currently, we're prioritizing appointments for people to receive their first and second doses, and then people who require a booster dose. The staff are doing their best to accommodate everyone. However, we request you book an appointment, to the extent possible, and to use the 1-877-374-0425 line. And as Premier Silver said, we need to thank our incredible team of immunizers and commend them for their hard work. We're very lucky to have such skilled and dedicated team, and I thank all of them. I want also to close with a thank you for all the businesses, NGOs, sports and recreation clubs and facilities, First Nations and municipal governments, and all Yukoners for taking these new emergency public health measures seriously and implementing them so quickly. Be kind when people ask to see your proof of vaccine. Be kind when they ask you to wear a mask. And, we're going to get through this together. Kindness is the key, especially as we, want to protect the upcoming Christmas season. I think if we stick together during the short period, we will succeed and be able to resume life as closer to normal shortly. Thank you.
Thank you, Dr. Corriveau. Thank you, Premier Silver. We will now move on to the question and answer session with media. A reminder to reporters, please identify which speaker you would like to answer your question before you start, and please also remember to mute and unmute yourselves. We will first go to the reporters in the room, and we'll start with Jackie at CBC.
Good morning. I think my first question is for Dr. Corriveau. I'm wondering if you have an actual number for how many cases have been in schools, including students and staff, since the beginning of the school year, and if you can provide an exact number of how many cases there have been in Yukoners under 12. I know you mentioned the 30%.
Yeah, I don't have the exact number with me right now, but I'm sure it can be provided to you through our comms. But like I said, it's been about 30% in the last little while, and it's not unexpected. I mean, we haven't been able to immunize that population, but really our focus has been to minimize the disruptions in the school system, which is still very important for our kids in terms of balancing the benefits of going to school versus and knowing also and having quite solid data that the transmission is still primarily occurring in the community and at home rather than in the school itself.
Thank you. Do you have a follow-up question, Jackie?
I do. This is kind of a two-parter, but since we only get two questions, I have to lump them in. I'm wondering if you can confirm the vaccination status of the most recent COVID-related death in the Yukon and just the vaccination statuses of people who have died. And also, is there any consideration for introducing rapid testing for students in schools?
Yeah, well, we don't provide personal health information on individual cases, so I certainly don't have this information with me, and I don't think I would provide it anyway with regard to the person who died. With regard to what was the second part of the question?
I'm just wondering about your thoughts or recommendations on rapid testing for students in schools. We understand that teachers are eligible, but I'm wondering is there any plan or suggestion that this could be available for students? Yeah, so
I've only been here a week, so I know that Dr. Elliott last week mentioned that we are looking at this. It's an active file right now. It's still not something that is being considered to put in place quickly, but we are exploring what the options are, and it's an evolving discussion in our office.
I could add into that as well, Jackie. We hear the concerns of communities that want to see more rapid testing. We also balance that with the recommendations from the Chief Medical Office and a worry of asymptomatic testing clogging up the system, what may not necessarily be better for the overall health. But I'm very confident in the conversations that the office has had with First Nations governments and also what we garner and relate through conversations through education and others to, again, identify these concerns because they're important. When people are concerned about testing, we need to make sure that our information is getting out there as to why and how we test. And so that was my conversation or my opening notes, but also understanding and recognizing that we always need to take into consideration the concerns of Yukoners as well. And I'm very pleased with the ability of the Chief Medical Officer of Health to adapt and to move and to transition. And hopefully in the end, with the accessibility through Health Canada of some other testing options as well, and our ability to work with First Nations communities and governments, students, we'll be able to continue to adapt and move forward to address these concerns.
Thank you. We'll now move to the phone lines and start with Claudienne at Radio-Canada.
Ah, bonjour, Dr. Corriveau, bienvenue. J'aimerais avoir un peu en français qui vient de se dire, il y a beaucoup de préoccupations, c'est vrai, chez les parents qui aimeraient voir des tests rapides offerts pour pouvoir prendre la décision le matin d'envoyer ou non leurs enfants à l'école. Vous-même, basé sur votre expérience dans d'autres juridictions, par exemple au territoire du Nord-Ouest, où on a un programme semblable, est-ce que c'est quelque chose, vous pensez, qui pourrait être avantageux au Yukon?
So, Dr. Corriveau, given your own experience in Northwest Territories and other places in the North, do you think it would be an advantage to have rapid testing for parents so that they can make a decision in the morning to know if they should or not send their kids to schools?
Bon, alors, écoutez, premièrement, la disponibilité des tests rapides de type antigène est très récente. Au Canada, ça fait juste quelques semaines que ça a été approuvé par Santé Canada. On a encore des préoccupations par rapport à leur sensibilité et la possibilité d'avoir des faux négatifs. Alors, c'est quelque chose que tout à l'heure j'ai dit en anglais, on est en train d'explorer. On consulte avec les quelques provinces et territoires qui ont commencé à utiliser ces tests-là. Puis, on va émettre des recommandations à ce sujet-là, mais on n'a pas fini notre analyse de cette situation-là. Puis, la perspective au Yukon aussi est importante. Quelle est la disponibilité des autres tests qui sont reconnus comme très performants, qu'on utilise dans notre système déjà? Il y a des discussions qui ont eu lieu cette semaine avec les Premières Nations au Yukon. Puis, c'est un dossier qui évolue rapidement, alors je ne peux pas vous donner une réponse définitive, mais on explore ça de façon active en ce moment.
Thank you. The doctor, could I get you to repeat that in English as well for the reporters on the line?
Yes, definitely. So I was just saying that, the availability of rapid tests is still limited. It's only recently been approved in Canada. And we're, sort of trying to learn from other jurisdictions about, not only if they're using it, but how it's working. And, and it's a very active file, but it's not at a point where we're ready to make a recommendation to the government at this point from our office. But more to follow for sure.
Thank you. Une autre question, Claudienne?
Oui, donc toujours par rapport à votre expertise puis votre expérience dans d'autres juridictions, à quoi est-ce qu'on peut s'attendre au cours des prochaines semaines quand on voit de la transmission communautaire dans les écoles, quand on peut présumer que les adultes ensuite sont aussi infectés ou vice-versa? À quoi est-ce qu'on peut s'attendre là, au cours des prochaines semaines par rapport à quand on se base sur ce qu'on a vu, entre autres, au TNO?
So, given your experience, what can the population expect in terms of community transmission with having kids transmitting maybe to their parents and having these community events? What is can the population expect will happen in the next coming weeks?
Bon, alors, merci pour cette question. Premièrement, je voudrais juste clarifier que ce qu'on remarque en ce moment, puis évidemment, c'est pas statique, là, mais c'est que la transmission aux enfants, elle vient autant des adultes que l'inverse. Alors, puis qu'on n'a pas vraiment beaucoup d'évidence, peut-être à une exception près, que la transmission se produit dans les écoles. Alors ça, je pense que c'est important de souligner ça. Puis l'autre chose, c'est que concernant, évidemment, personne n'a une boule de cristal, mais de mon expérience, tant en Alberta qu'au territoire du Nord où j'ai travaillé plus récemment, Je pense que le Yukon est en très bonne position. Vos taux d'immunisation de base sont plus élevés. On n'a pas vu une grosse augmentation des cas à l'hôpital au cours de la dernière semaine. Alors, ça indique qu'on a une bonne base de protection. Puis si on peut l'augmenter un petit peu plus, on devrait pouvoir passer à travers cette vague-ci de façon plus rapide qu'ailleurs, puis de façon où il y a moins d'impact à long terme. Alors, c'est mon impression et on va continuer à pousser très fort pour augmenter le taux de vaccination complète, puis de pouvoir bouger rapidement aussitôt que le vaccin pour les 5 à 11 ans va avoir été approuvé par Santé Canada.
Merci.
Do you want me to translate in
If you
Yes.
can, briefly, thank you.
So there were two parts to the questions, but first of all, of course there is concern about kids transmitting to their parents, but at this point we're seeing almost the inverse, is that many of the kids are getting it from the community settings, from the home setting, and there's not been, maybe at one exception, real evidence of transmission taking place in the schools. Many of the notifications we send out, we have, a kid who's noted to be positive, and then we don't see any further spread in the classroom. And it's an issue that we're monitoring very closely, working with the school system. We're spending a lot of time with the school system to make sure that everything is in place to minimize that risk, so that school is not disrupted. Because school has a lot of benefits and is a critical program, for kids, and we don't want to we want to minimize any disruption that takes place there unless it's absolutely necessary.
Thank you. We'll now move to Haley at Yukon News.
Thank you. My first question was for the Premier. I'm wondering if you could give us an update on the search for a new Chief Medical Officer of Health.
I can't. That's done by the department. I believe the tender is out, and I really don't have any new information on that. Sorry, Haley.
Thank you. Haley, do you have another question?
Yeah, I do. Thank you. A question for Dr. Corriveau. You had mentioned that we're still seeing an increase in vaccination levels. I'm wondering if you had any more detailed information about how many more vaccine appointments have been booked since the new sort of stricter measures were announced.
Yeah, I don't have the this data with me right now, but I believe it's posted on the website and updated regularly. So that's what I would recommend at this point. Sorry.
Let's give Haley another question, because her first one to me, I don't have any information for her, if she has one.
Wonderful. Haley, do you have another question?
I don't think I do. No, thank you. Those were my two. I'll follow up with the department to try and get some of the changes over time for the vaccine numbers. Thanks.
Thank you. We'll now move to Tim at the Whitehorse Star.
Yes, good morning. Can you hear me?
We can. Thanks, Tim.
Okay. I think my first question would be for Dr. Corriveau. The Premier can jump in if you like. I had a reader send me some numbers from the federal government website on the number of caseloads here in the Yukon versus what the Yukon government is putting out, and there was a discrepancy of at least 50 cases, with the federal numbers being quite a bit higher. Any reasonable explanation for that?
I don't. I'm not able to comment on the discrepancy. Whether it was it in rates or in numbers?
In numbers, number of active cases.
I would hate to speculate on what the discrepancy is all about, because I haven't looked into it.
I just know also, Tim, in the past, it's a difference of different denominators and ratios, and if you're comparing active cases to case counts. So we'll take a look at the different information. Sometimes it's as simple as time logs, time lags in between, but without knowing, this is the first I've heard of it as well, so we'll take a look at that.
Thank you. Tim, do you have a follow-up question?
I do. This one would be for the Premier. I've had a number of people asking, including the Teachers Federation, for good explanation as to why the teachers were not aware that they were eligible for rapid testing. Any further detail you can add to that?
Yeah, just what I said in my opening comments, Tim. You know, I explained what the system has been and has been for a while now. To hear that there's been a lack of understanding from the teacher's perspective, I'll have to take a look into that. But, you know, our messaging has been succinct here that, you know, again, for specific reasons and purposes, there is and has always been access to rapid testing. But again, we're going to look to make sure that our communication is done as promptly and as effectively as possible. So this is new to me to hear these things as well. So we'll get to the bottom of it and report back. But yeah, again, the process as I spoke to in my beginning comments.
Thank you. We'll now move to Luke at CKRW. Hello, Luke, can you hear us? Trying one more time. Luke at CKRW.
Here.
Are there any other reporters on the line I might have missed? And I'll try one final time. Luke at CKRW. Okay, that concludes our COVID-19 update. Our next COVID-19 update will be next week. Thank you again to our speakers, and thank you to all the media and everyone who tuned in to watch live over Facebook. Stay safe and stay kind, everyone.